What was once used to reach rural populations, COVID accelerated the use case for this one thing.
Telehealth visits have expanded rapidly.
We've grown comfortable communicating with one another through pixels on a screen. That comfort, combined with rapid advances in health monitoring technology, is fueling a new boom in telemedicine.
This has been one of the most significant shifts in healthcare delivery over the past decade. But when did this begin? I dug deep into the research to find its genesis and conception. In this episode of Health Tech with Tyler, we're going to learn about telemedicine and the untold future it will have on the American healthcare system. From its earliest depictions over 100 years ago in 1923, to the Nebraska Psychiatric Institute using it in the 1950s, to NASA, of all people, using telemedicine in the 1970s, and then, of course, the advent of the internet in the 1990s. But in order to understand the future of telemedicine, we have to take a look in the past. In 1923, a magazine known as Scientific American published a depiction of Hugo Gernsback predicting telemedicine. Though Gernsback was onto something, it wouldn't be until the 1950s that a real-life use case was presented for telemedicine. Early experiments were conducted by the Nebraska Psychiatric Institute. They used closed-circuit televisions to provide consultations between the Nebraska Psychiatric Institute and Norfolk State Hospital. This work, conducted by Cecil Whitston, would serve as the foundation to further develop telehealth. A decade later, during the 1960s and 70s, NASA was using telemedicine to monitor astronauts' health during space missions. In the mid-1970s, NASA decided to launch a program called StarPack. StarPack had two main objectives. Firstly, to obtain data for application of future spacecraft design. And secondly, to improve healthcare delivery through application of space technology. Essentially testing on Earth so they could use it in space. To do this research, they went to the Papago Indian Reservation in southwest Arizona. Some notable accomplishments were that they were able to establish the functional, operational design, and interface requirements needed for something like this. Basically, they developed a proof of concept that would need further investigation. And then 15 years later, a revolution happens, changing telemedicine forever.
Just what is this main artery of the information superhighway?
Every business, no matter how large, no matter how small, will be on the internet in the year 2000.
Are a lot of people just getting onto the internet because they feel that they have to get onto the playing field, so to speak?
But it's very hip to be on the internet right now.
Today, we're going to be showing our friends Andrew and Lisa the basics of the internet.
The internet is a whole group of networks.
Nowadays, just about anyone with a computer and a modem can join in.
One danger is this could turn out to be an elitist system, one available only to people with a computer and a modem.
The 1990s, the decade of the internet invention. The advent of the internet would now skyrocket further development in telemedicine. I mean, just look at this computer from the 1990s and then look at what we have today. It's kind of mind-blowing when you think about the history of mankind. Now, with the advent of personal computing power, widespread adoption was now possible. So, which companies would be adopting telemedicine? Massachusetts General Hospital has been a major pioneer in telemedicine, implementing a telehealth program to provide specialist consultations to remote patients in 1996. The program was led by Dr. Lee Schwam, and the goal was to fine-tune the processes and protocols that would enable a remote model of clinical care for acute stroke.
The care you receive is highly dependent on where you live. If you're lucky enough to live in a big city near a well-known hospital, you're likely to get access to really excellent care in many different specialties. But if you live in a smaller city or a suburb, or even worse, if you live in more rural parts of this country, you really have limited access to specialty care, and in some cases no access at all. The teleneurology program was really born with TeleStroke, which was applying telemedicine capabilities to the evaluation of patients with stroke. And that was the perfect marriage of a very algorithm-driven process of deciding whether someone was eligible for a medicine called TPA, or a clot-busting medication, with readily available image viewing software and readily available and highly reliable video conferencing.
Dr. Schwam was ahead of his time and now continues as Yale's Chief Digital Health Officer and Associate Dean for Digital Strategy and Transformation. His program would continue to evolve, and by 2019, Mass General saw more than 10,000 virtual visits and more than 36,000 virtual encounters overall. Following 2019, another major transformation in telemedicine occurs.
The number of cases soaring just today, more than 24,000 now nationwide. New Jersey today becoming the 6th state to close all non-essential businesses, joining California, New York, Illinois, Pennsylvania, and Nevada. More than 80 million Americans now told to stay at home.
New York, California, Illinois, and Connecticut all ordering non-essential employees to stay home. Those orders cover 75 million people across the United States.
These are not helpful hints. This is not if you really want to be a great citizen. These are legal provisions. Again, your actions can affect my health. That's where we are.
Health systems rushed to expand their virtual offerings with ever-growing demand. Kaiser Permanente was no different. They were investing in and using telehealth long before the pandemic, which meant they had already had a strong infrastructure in place. With this, Kaiser was able to rapidly scale their virtual services to meet increased demand. Kaiser charts that in 2019, their use of email and phone visits was around 60%. And then in 2020, this number grew to 80%, a 20% increase from the previous year alone. Basic benefits like lower cost and lower wait times were seen at Kaiser, but what were some of the overall benefits that were seen nationwide? A 2018 study by Dr. David Levine and colleagues showed that the median direct cost of acute care for patients that were administered care at home were 52% lower than for those in a normal hospital setting.
Advanced care at home programs are based on a growing body of evidence that show patients are more satisfied with their care, and family stress is reduced. Patient functional mobility and activity tends to be higher, and quality outcomes are the same or better than being in a hospital.
Beyond cost, telemedicine has been shown to improve access to care. In rural areas, telemedicine can bridge the gap for patients, providing access to specialists who are otherwise unavailable locally. As for frequency of care, regular monitoring and follow-up through telemedicine can lead to better management of chronic diseases and conditions. Now, as pointed out by the 2018 study from the Journal of Internal Medicine, telehealth can reduce the need for hospital visits and in doing so can also reduce overall healthcare costs. Even added benefits like reducing wait times and the need to commute can save patients time and money. It also has an added benefit for allowing physicians to see more patients. Like with anything, there's always the negative.
The fallout is far from over after a security breach at Change Healthcare, which is part of the United Health Group.
He tells me, quote, "We are aware of this global IT disruption and have been in close contact with the vendor. We're in the process of assessing the impact of the disruption on our clinical and surgical operations."
But that global computer outage has definitely caused some challenges and concerns.
Cyber attack disrupting all 13 of its Michigan hospitals, plus its network of 113,000 medical providers across the state and in Indiana and Ohio.
Health leaders say they're still trying to figure out whether patient or employee health data was compromised.
Data privacy and security are always going to be a concern when considering telemedicine. And there's definitely an increased demand in ensuring secure patient transmission of data across systems. But data privacy and security are not the only problems. What about access to care? See, there's a lot of people in this nation and beyond that might not have access to technology and reliable internet. And then finally, regulatory issues. Politics. Always the issue. Telemedicine regulations vary widely by region. This definitely impacts its implementation and scalability. And then there's insurance. It's not always clear and consistent on what coverage types you have in telemedicine services, leaving patients confused. When there's limitations and challenges in any industry, inventors emerge. Innovation continues to drive the expansion and enhancement of telemedicine services, making it more effective and accessible. A company called Digital Diagnostics launched a product called Luminetics Core. This product is the first FDA-approved AI diagnostics able to detect diabetic retinopathy at the point of care. They claim that what previously took hours or days to diagnose can now be done instantly. Their overall goal? To transform the affordability, accessibility, and quality of healthcare worldwide. In the field of real-time monitoring, health systems like Tacoma, Washington-based healthcare system Multicam uses Apple Watches to gather patient data in their cardiac rehabilitation program. Well, we should note that a number of healthcare professionals call into question the reliability of current wearable devices on the market, but that might be a video for another time. Anyways, wearable devices are even changing, from the wrist to even the clothes. There's a company called NanoWear that's really leading that transformation.
Co-founder and CEO of NanoWear. We're a New York-based connected self-technology platform for diagnostics and chronic disease management, built upon what we call our core invention of cloth-based nanosensor technology, capable of capturing near-invisible frequency bands of electrical, hemodynamic, sound, audio, biochemical, and actigraphy parameters directly from the skin. What this ultimately does is enable very clean inputs and ultimately stronger analytical outcomes. First application is for Medicare's public enemy number one, congestive heart failure. This is Edna, 67-year-old Medicare patient, grandmother of 3, still working. Sadly, she was hospitalized 7 times in 2017. And the scary thing is she's not alone. 6 million other Americans have been diagnosed, 36 billion in annual costs associated with CHF, with hospital providers now being penalized to needing to reduce those hospital readmissions. The standard of care is either too expensive or is ineffective in reducing these readmissions. And that's the unmet clinical need that we are introducing at NanoWear with our first product, Simple Sense. It's a sash-like undergarment that will transmit via a patient's cell phone, a HIPAA-compliant portal where server analytics will detect decompensating heart failure weeks in advance of a hospitalizing event. We are really excited about what we have accomplished with this build. We're raising $9 million in an A round. 50% has been committed to by strategics. They're recognizing the cloth-based nanosensor technology. We're the only game in town with that. It's defended with a robust IP portfolio, further defended by our first FDA 510(k) clearance last year, making us the first and only cloth-based remote monitoring system in the world that's been approved by the FDA. Think about what can be done even beyond CHF. Think about replacing every wired electrode in the ICU with a bed sheet. Think about doing imaging for complex procedures with a hospital gown. Think about a pharmaceutical at-home therapy with a companion device that's easy to use. Think about applications beyond healthcare, industrial use cases, our men and women on the battlefield, our EMTs, our firefighters. All of these markets are available to this cloth-based system, but we felt that if we could nail a complex disease state like CHF and help our highest risk patients first, gravity would pull us into these markets. But most importantly, we can help Edna and the millions of others suffering from this incurable disease get back to the life they deserve. Thank you.
Finally, virtual reality is changing the status quo in healthcare. VR is used for remote physical therapy and mental health treatments, providing immersive and interactive healthcare experiences. Let's hear from Dr. Brendan Spiegel on the future of VR in healthcare.
What I think is going to begin happening as we start to see VR becoming more and more evidence-based is there may be a new type of clinician called a virtualist. The virtualist will be somebody who is an expert in administering immersive therapeutics. I've been talking about VR today, but there's also AR, there's something called MR, there's XR, but all together we call these immersive therapeutics, and the virtualist will interact with all sorts of different clinicians. So, VR is used for everything from stroke rehabilitation to pain management and on, anxiety, depression, mental health. The virtualist will work with all those different doctors and be an expert in the interactions with technology and patient care. So I think we're going to start seeing more and more a new type of specialty emerge. And also the FDA is becoming much more engaged in this, and the NIH is becoming more engaged in this. We just received a grant from the NIH to really study in more detail how VR is working. So all of these are just to say that I think more and more we're going to see VR becoming a more regular part of the everyday care of patients, not just in hospitals like Cedars-Sinai, but in the community as well.
From a sketch in 1923 all the way to the emerging technologies of today, telemedicine has already come a long way, and it's going to continue in its strides moving forward. Case studies like Massachusetts General and Kaiser Permanente illustrate the profound impact that telemedicine has on patient care and outcomes. But when digging deep into this research, I was still left with a few questions. Number one, did NASA continue or discontinue their telemedicine program? And if so, what does it look like today? Now, there's no information on StartPEC online that I could find, whether it's like a documentary or anything. The only information I was able to find was actually their full-page PDF research paper on their website, which I've conveniently linked for you in the description. Next question, AI in healthcare. Do you want that? Is it good? I understand that healthcare is going to continue to be shaped by technology, but what about personalization? What about human interaction? Is that going to play a part in the care? Thirdly, wearable devices. I've heard doctors report that patients came in with reported cardiac episodes from their wearable technology, but they hadn't had any. So is this going to change? Is this going to be fixed? Who's going to fix this? Will I get robotic arms? That's not in here. But seriously, you're going to want to subscribe because we're going to continue to go in depth to reveal all that's behind hidden doors in health tech. So subscribe, hit the like button, press the notification bell so that when the next episode drops, you'll be the first to know.